Hey guys, this is Shahadat, and in this video today, I'm going to review or react to the video that you can see on the screen on the right hand side. The title of the video is The Cancer Explainer by Dr. Sewanti Lamaye, and this is presented to us by the Faye D'souza show. So Faye D'souza show. I'm finding it difficult to pronounce that word. Um, so um, I'm reacting to this video because after watching this video, you will probably think that the cancer is a very complicated disease, but recent evidence actually suggests that cancer is not really a complicated disease. It's pretty simple disease. It is difficult to deal with, but the actual disease itself is pretty simple. And in this video, while reacting to their conversation, I'm going to give you the information, the most recent ideas about what cancer really is, and so that you can you have a better understanding of this disease and how to deal with it if you know anybody or if you yourself are fighting with this disease. So without further ado, let's start.
Thank you so much for speaking with me. I'm going to start with a really basic question. Please, what is cancer and how does it find its way into our organs and which organ it chooses to sort of set up shop in? How does that happen?
So the question is, what is cancer and how does it basically get hold of our body? How does it manage to take up space and start spreading inside our body? That's basically the question. Let's listen to what Dr. Sewanti has to say
The
about
fact
it.
that is known is there's uncontrolled multiplication of cells that happen with a trigger. So some trigger happens with which particular cells in our body may start multiplying in an uncontrollable way and become a mass. And that is the definition of neoplasia or cancer, as we have understood over the last several decades. But what is poorly understood is what
Please, stop
These
using ChatGPT
advertisements
like
are
Google. Disappear for a month
driving me
and do this instead.
crazy.
are those triggers. So we understand some triggers, like tobacco and cancer. We understand that trigger. Like chewing tobacco and oral cavity cancer. We understand that trigger. We understand the trigger of hormone and breast cancer. But why does a non-smoker get cancer of the lung, like my mom did? That trigger is not very well understood. It is only being unraveled now. And at least for lung cancer, I have some explanation. But for many other cancers, I actually don't. And I'll explain that in a moment. If you see the pollution levels, it was found in 40,000 subjects that were studied in UK that the pollution was more than X level that was equal to getting a particular type of lung cancer, that is non-smoker's lung cancer. So at least that got proven. But I have a patient in my practice who has advanced pancreas cancer, who is not diabetic, who has always been vegetarian, who walks at least 10 kilometers a day, who is a spiritual man, and has advanced pancreatic cancer, where if you read the line writing on the wall, the lifespan is less than a year. So what was his trigger? He doesn't even have a family history. Some cancers happen because of substance abuse, like nicotine, for example.
So before going into the substance use or the next part of the discussion, let me tell you how what cancer is and how we get cancer. Obviously, Dr. Sewanti told us her version of what cancer is, but um, I'm sure you are not very clear about exactly what causes, how smoking causes cancer. How does smoking cause cancer? That's the question I'm going to try to explain. Now, you have to understand a few things here. First, cancer cells are actually cells of our body. So the first cancer cell that starts dividing into 2, 4, 8, and multiply like that, the first cell was a cell of our body. It was a healthy cell at one point. But then it developed this weird behavior. It got sick and started multiplying without following the instruction of the body, without the basically denying to obey by the rules of the body and start multiplying just like that. So how does that happen? Professor Dr. Thomas Seyfried, based on the theory of Dr. Otto Warburg, who back in 1924 first proposed that cancer is a mitochondrial metabolic disease. So let me unpack that for you a little bit. So we have got trillions of cells in our body. Each cell is like a small blob, which has got a nucleus inside. The nucleus contains the DNA, the genes, stuff like that. And then there are other organelles like mitochondria, then lysosome. The inside the cell, other than these little organelles, whatever is left is called cytoplasm. So these are now different organelles, different parts of a cell. The mitochondria, the primary job of a mitochondria, as we used to think, is to produce energy, ATP, for the cell, because the cell does everything using ATP. And the mitochondria's job was to produce ATP. Now, if for any reason the mitochondria gets damaged, but not acutely. So if the mitochondria gets damaged acutely and stops producing energy, the cell will die immediately. And you cannot get cancer from a dead cell. But if the environment is so that the mitochondria is not being able to perform to its best capability, but it's not like the mitochondria is completely shut off. So it's working, but it's not working, it's not really performing to its capacity. If that's the situation, then the cell finds itself in a tricky situation where the cell needs ATP and the mitochondria is not being able to produce the required amount of ATP. And because this is a slow process, what happens in this time, sometimes it takes a few years to develop the first cancerous cell in our body. So what happens is the mitochondria is gradually losing its power, losing its ability to produce energy for the cell. And the mitochondria can communicate that back to the cell. The mitochondria can tell the cell, the nucleus, that I'm not being able to produce energy, so look for other ways. Now, each and every cell of our body has this other mechanism of producing ATP through a process called, in simple English, it's called fermentation, and in technical term, they call it substrate level phosphorylation. This is a process where without oxygen, glucose can be broken down to produce ATP. In the mitochondria, we use oxygen. The mitochondria basically uses oxygen to break down, say, carbohydrate, that means glucose, or other things like ketone bodies, and then fatty acids, all these fuels that can be used to produce ATP. The mitochondria actually breaks these fuel down with or using oxygen. But this process is called the oxidative phosphorylation, the phosphorylation process, which is using oxygen. Whereas the other type of energy producing mechanism, the fermentation, does not need oxygen. So when the cell is in a environment where it is going through some kind of pressure and the mitochondria is not being able to produce enough ATP, the cell then turns to this other mechanism of producing ATP. And when the mitochondria gradually keeps on going down and this ATP production through the substrate level phosphorylation or fermentation process keeps on going up, at one point, the mitochondria becomes redundant. It's not necessary anymore for the cell to survive. And the cell actually, the mitochondria basically is retired at that point. So it is not used anymore. And the mitochondria is damaged or reduced in number. So if that happens, then this cell can become a cancerous cell. Why? Because mitochondria, we used to think that the mitochondria is just the powerhouse of the cell, but recent discoveries says that mitochondria does pretty much everything inside the cell. So if the mitochondria is damaged and it's not working, then the way our the cell was communicating with the whole body system, that breaks down. So the cell cannot listen to the instructions sent by the body to the cell, and the cell cannot send messages out to the body, and so it becomes a problematic situation. And that's when the cell basically starts behaving like a single-celled organism, like a bacteria. And as long as there is food, it keeps on growing growing, growing, and growing. And the such a cell only dies if the food, the fuel supply is cut off. Otherwise, it keeps on growing. And that's exactly what happens in case of cancer. So oncologists like Dr. Sewanti will say that cancer is a genetic disease, but this other theory says cancer is not a genetic disease. I mean, cancer can be a genetic disease in a very small number of cases, but mostly cancer is a mitochondrial metabolic disease. That means it's a disease that is caused by damaged mitochondria. Now, the next question is, how does the mitochondria get damaged? Well, the direct cause of that is inflammation. So whatever you do that raises your inflammation level and keeps it raised for few years, that will cause cancer. That will trigger. That will. That basically can. I shouldn't say will. That actually can change one of our cells or few of our cells to become cancerous. So that's why there are so many different kinds of triggers. And these are all secondary triggers, secondary risk factors, as Professor Dr. Thomas Seyfried says, because these are not directly linked to the cancer development. What they do is, like, if you think about long-term inflammation, if the person is going through long-term stress, stress causes inflammation. If the person is infected by virus or bacteria, or the environment, if the environment is toxic, if you live in an area where there are radioactivity or radioactive substances, you consume them, or you are exposed to radioactive substances, all these things can actually raise inflammation in your body. And inflammation is the direct controller, direct cause that basically impairs the function of a mitochondria. So now, hopefully, you see how this whole thing goes on, even though the triggers are all sorts of different triggers, but they all trickle down to this one path, which is inflammation. And that then cause the mitochondria not to function properly. And that basically forces the cell to start producing energy in a different part in the using the fermentation method, even though oxygen is present. Because the fermentation method is supposed to be used if oxygen is not available in the environment. But if in case of cancer, even if there is oxygen inside the cell will not use oxygen to produce ATP. Rather, it will just produce ATP using this process, as I said, called fermentation. Um, in case of cancer, it's called aerobic glycolysis. Aerobic glycolysis because oxygen is present in the environment, but still the cell is going through this fermentation process. Whereas under normal circumstances, if the cell becomes anaerobic, that means if oxygen is not there, that's when this other process should start. But in cancer's case, it starts even though you have oxygen inside the cell. So that's basically the mechanism. So with that explanation, I hope you can understand that this is quite simple. And at the same time, kind of like controlling these cancer cells at that point becomes quite simple as well, because you can control the supply of sugar in your body, because um, the other fuels like ketone bodies, the free fatty acids, they cannot be used by the cancer cells, because you need a functioning healthy mitochondria to break down these fuels and basically produce ATP. But in a cancer cell, because the mitochondria are broken, the cell just doesn't have the ability to produce energy from fat or ketone bodies. So that's a distinction we need to remember, and that makes it very simple to attack the cancer cells saving all our healthy cells. What do? You follow a ketogenic diet to start with. So you get rid of carbs from your diet. If you can completely get rid of carbs from your diet, that will force your body to go low sugar. Not hypoglycemia though, because our liver can produce glucose when necessary. So that's why the liver produces glucose, and the minimum amount of glucose that is required for our survival will always be there in the blood. Okay, but if you have extra, obviously the cancer cells can consume extra. Now, cancer cells can consume up to 200 times more glucose compared to normal cells. So if we stop consuming glucose, and the level of blood glucose goes down to the minimum required for our survival, what happens is the body becomes very careful in terms of who gets this glucose. And cancer cells, obviously, because they are not doing any good for the whole body, they actually get the least supply. The other thing is, when the glucose level in your blood goes down, the insulin hormone also goes down. Now, the cancer cells have about 15 times more insulin receptor on their surface. The idea is the more insulin you can take, the more insulin can open up more doors to get glucose inside the cell. And that's what they need. But if the insulin is low, you don't get that stimulation. So these cancer cells cannot take a ton of sugar in, or whatever sugar is available in the bloodstream. The cancer cell finds it very difficult to even consume that sugar and take it in for their ATP production. So in this way, we can basically weaken the cancer cells, specifically the cancer cells, because when we shift our body to that state, low glucose, low insulin state, our body starts running on fat. It produces ketone, it produces free fatty acids, and the ketone basically goes and supplies fuel to the brain mostly. That's the primary target, and then it supplies fuel to some other parts of the body as well. And the muscles, they run on free fatty acid and stuff like that. So when you are in that ketotic state, when your body is producing ketone bodies, what happens is your cancer cells are already under a tremendous pressure. So according to the press pulse therapy concept proposed by Dr. Thomas Seyfried, um, cancer patients should always be on ketosis. So they should stick to a ketogenic diet. They should strictly stick to a ketogenic diet so that their body produces tons of ketones and the body doesn't have any extra sugar at all. So a cancer patient can have protein and fat, healthy fat, but they should avoid carbohydrates. If they can avoid even vegetables, that's going to be good for them. So that's basically how we can address cancer as well. But anyway, I'm kind of like jumping ahead a little bit. Let's listen to the next part of the discussion and take it from there.
If you drink a lot, your liver might have cirrhosis that weakens the liver, it will lead to cancer, that sort of thing. Some of it is genetic, right? Some of it is hormone-led. Yeah. Some of it, and we're reading in our papers every day that microplastics and this sort of fertilizer, that sort of pesticide, the chemicals that are finding their way into our food, into our environment, into the air, into the water, are carcinogenic, and that causes cancer. Could you, if I would break that down, could you explain to me what carcinogenic is?
So now the question is what carcinogenic is, and hopefully by now you understand what carcinogenic is. All these triggers, if you think about them, then you'll see that each and every one of them, including the hormones, including the genetic triggers, they somehow affect the mitochondria. The direct cause in most cases is raise inflammation in the body. It doesn't have to, the body doesn't, the trigger doesn't have to raise the inflammation to really high. A little bit little bit inflammation can cause this trouble. Okay. So, and in case of the genetic causes, where there are some, like BRCA1 is a genetic mutation that if somebody has, a woman has, then she has about 60% chance of getting cancer. And Professor Thomas Seyfried explained that people who have the BRCA1 gene, usually their mitochondria get damaged quickly, easily. So that's how the whole thing basically happens.
The word carcinogenesis essentially means when something comes into the system and cancer formation happens. Cancer formation or cancer development is essentially equal to cells multiplying uncontrollably. So the control is gone. Okay, and that trigger is from carcinogens. That trigger that brings about uncontrolled multiplication is from things that we do or where we live or that are around us that could then just press that button to multiply, to help multiply the cells uncontrollably.
Before that happens, obviously, the cell goes through a transformation. As I explained, the mitochondria gets damaged, and the cell then shifts to producing energy through substrate level phosphorylation or fermentation using primarily glucose. It can use another fuel called glutamine. So we will talk about that as well a bit later. But primarily, it relies on glucose.
That's the trigger that can be reproduced.
Now let me show you what we do here.
Next advertisement.
With
This is
Instituto,
so
you can take
annoying. Blah,
any
blah, blah,
image
blah, blah,
and
blah,
turn
blah,
it
blah.
into a
Go
sketch
away.
in just 3
Go away.
That's a carcinogen. So if tobacco in multiple settings is doing this, is triggering off this uncontrolled multiplication in this setting, in that setting, in that setting, in that setting, then you know that this is reproducible and this is going ahead with causing this pulley to be off and that multiplication to happen uncontrolled way, all the way. And it can be reproduced. It's not something that is just one time. It is something that is reoccurring in people and people and people. Right. And that's where people pick up a pattern and they understand, okay, don't get exposed to this because this can cause the uncontrolled multiplication in my body.
So when that uncontrolled multiplication happens and it leads to a tumor,
Yeah,
all tumors are not malignant.
that's correct. Very correct. So just the lump that forms out of multiplied cells is not enough. That could be a benign tumor. Benign tumor may not have the ability to encroach on other organs. It may not have the ability to metastasize, which means break away and go and take over the body and really hurt different organs. When we have a malignant tumor, it's mostly not looking anywhere like its original form. It transforms. It is because of these mutations that happen. The DNA damage is inherent portion of this conversion from benign to malignant. So when the hurt happens through these carcinogens to the cell, one thing that happens is uncontrolled multiplication. The other hurt that happens is it gets into the core of the cell within the nucleus, and the essence of our cell is the DNA. And it goes and causes breakage in the DNA, and these are called mutations. And these mutations then transform the working of the cell, the look of the cell, how the cell is going to act, and it completely goes rogue.
So this explanation is to some extent correct, but the thing is, how is the trigger going in and modifying the DNA? How is it modifying the gene? And the explanation from Professor Thomas Seyfried is very simple. When the cell starts producing ATP through using this fermentation method inside in the cytoplasm, that means the aerobic glycolysis, as I said before. When that happens, this process actually produces a lot of reactive oxygen species. So these reactive oxygen species are not something, it's like smoke that comes out from a kind of like a faulty engine. So black smoke and ROS is something like that. I mean, we can probably use that comparison to understand it. So this ROS can then get into the nucleus of the cell. And this ROS can actually damage the DNA. ROS are mitogenic. No, the word is wrong. ROS are reactive oxygen species, ROS, ROS. They are carcinogenic and at the same time mutagenic. I was looking for the mutagenic, not mitogenic. Mutagenic. That means they can cause DNA mutation and they can actually cause the cancer to start, the cancer process to start. So that means ROS can damage the mitochondria, which can force then the production of fuel outside the mitochondria using the fermentation method. So when the cancer process starts in the cell, it produces more ROS, and then more ROS gets into the nucleus and messes up the DNA, and that's how we get the DNA modification. So the DNA modification, the gene mutation, is actually the result of the cell becoming cancerous, not the cause.
We hear, doctors will say the cancer has now spread to your lung.
The other thing I quickly wanted to explain is metastasis. How does that happen? So, we in our body, there are different sorts of cells: liver cells, eye cells, brain cells, and the cells are kind of like limited to their own space. A liver cell will not go and try to live inside my brain. The brain cell will not go and try to live inside my liver. That's how, these cells have got these rules and they abide by these rules. But what happens is, in case of cancer is like, because the inflammation is raised, cancer is like injury inside your body. So if you have a cut outside, on your skin, the way the body tries to heal that cut, body does the same thing in case of cancer, because the body thinks it's a cut inside our body, inside one of the organs. So the macrophage cell, which is responsible for dealing with inflammation, dealing with any kind of rogue bacterias or things like those. This is like the soldiers that are trying to make sure that the body is running perfectly and there is no threat from anywhere. So these macrophage cells have the ability to actually travel from one place to another inside our body. The macrophage cells can leave a tissue. That means, say, macrophage cell was inside the liver. It can actually leave the liver and get into the blood, travel some distance, go to another organ, and then leave the blood and get inside that other organ. This is the innate power of the macrophage cell. The macrophage cell's responsibility is to fix infections. So, because the body thinks cancer as an infection inside the body, macrophage cells are sent to deal with it. Macrophage cells go and try to fix it, give them cytokine and various other things, trying to fix it. But because the mitochondria are broken, the communication doesn't happen properly, and the problem keeps on growing bigger. At that point, the mitochondria tries to basically diffuse with the fuse with the cancer cell in an attempt to basically disable or destroy the cell. But unfortunately, in some cases, or quite a lot of cases actually, what happens is the cancer cells, ROS and broken mitochondria and all those things get inside the macrophage cell at that point, becomes one cell, and the net result becomes that the macrophage cell now is a cancerous cell because it has got a ton of broken mitochondria. Now it cannot produce energy for these two cells together, and now the cell has to start producing ATP through the fermentation process. Now, because this cell already had the ability to get out from where it was originated and then travel to a different place and try to settle there, because of this power of macrophage, that's how cancer cells spread from one organ to the whole body. So, hope you can see that this explanation is far simpler and it actually makes sense. And testing the cancer cells, Professor Thomas Seyfried said that he tested thousands and thousands of samples of cancer cells, and in every single case, he found either the mitochondria are damaged, they have got the wrong shape, they don't have the cristae as it is supposed to be there, or the total number of mitochondria is so low that the cell cannot actually produce enough ATP for itself, even though these mitochondria were kind of like okay in terms of shape. So number and the structure of the mitochondria both are having an impact on this particular problem. So that's how the the cancer actually spreads from one organ to multiple organ, and it can settle in other organs because it is actually a macrophage cell that has gone rogue at this point.
lungs and your pancreas and your stomach. What you're saying is effectively the cancer is just chomping on the cells in all of these organs.
Cancer mutated and now just running amok and going here and going there.
This is destroying organs one by one.
Yeah. Encroach.
Yeah, cancer does that. Wherever the new cell it goes and settles, cancer, because the way it works, it produces a lot of lactate, which is acidic substance. So that acid comes out of the cell, and the cells around this cancer cell, they cannot deal with this extra acid load, and their membranes get broken. And the cancer cell actually uses the substances, the organelles inside those cells, and try to make new ones. So, and this process keeps on going. So this is a terrible thing. Once you have cancer, it becomes very difficult to deal with it. But obviously, if we can control the fuel supply, then we can control the growth of the cancer without using any toxic chemicals.
Organs. Whether it destroys or not comes after, but at least encroaching, getting there, making a space, pushing away all the normal cells, and encroaching those organs. And that's where, if the patient comes in, where we can make a difference, where we can figure out what is really happening to that person and stop it there, then you prevent organ failure and organ dysfunction.
True.
I have so many questions. But let's first talk about just screening and detection, right? Which I know is really important to you, and that's one of the reasons why we're having this conversation. I remember again somebody telling me that in India, as opposed to overseas, testing is not so out of reach. We tend to test a lot more, right? At least in urban India, than people do overseas, because the doctor will immediately say, MRI karo, ye karo, wo karo, something, and we don't have to wait in line as much as they do, say, with the NHS in UK or any of these other systems. So we test.
So please remember, Faye here is saying that we have plenty of opportunities for testing in India. Obviously, she's talking about India. But then Dr. Sewanti, her response was like a little bit different, but let's listen to that.
A lot more preventively, and as a result, we tend to detect earlier. Is that true?
So we could detect earlier
if we tested more.
Yes. So I'll give you a quick anecdote, and that helps you understand this. So I was at a meeting in Singapore where we were putting together a coalition. It is called Asia Pacific Coalition Against Lung Cancer. So I'd gone there for that founding meeting, and I was sitting next to my Japanese colleague, and he was to present the data from Japan, and I was to present the data from India. So he went before me, and he presented 75% of lung cancers in Japan are diagnosed in stage 1.
Advertisements again. I hate you guys. I mean, I really, really hate you.
And 25% of lung cancers in Japan are diagnosed in stage 4. And next came my slides. After his presentation was done, my slides went up, and I had the exact opposite data. 75% of cancers in India are diagnosed in stage 4, and 25% of lung cancers are diagnosed in stage 1 or early stage. And why that? And just taking a moment to understand what was different with Japan was that they had CT scanners at every corner of their community, and they had general practitioners reading the scans. And so if anyone had a cough, they would do a scan. If anyone had a shortness of breath, they would do a scan. And so their scans, low-dose CT scans of the chest, was happening in a jiffy. They had enhanced their providers in a way that their general practitioners were reading CT scans, and if they found something obvious, then they would send the scan to a radiologist, because you can't have that many super specialists in a country.
So the primary healthcare was able to do the first round of screening.
Exactly. And bringing that analogy to what you're saying, yes, in India, our tests are very, very quick. So we could actually engage in a higher level screening, but we don't. And that's, so, in India, healthcare is always about seeking a doctor when we are sick. Preventive healthcare has really not got speed. And I think that is because we have limited resources. So we utilize the resources to send our child to school. We utilize resources to buy a home. We utilize resources to buy a car, to maybe take care of our parents, to maybe take everybody out for a dinner once a year. We are dealing with very focused resources. Where when we are sick, we of course make time and money to take care of our loved ones. 80% of Indian healthcare, or cancer care, I should say, not healthcare in general, but cancer care, 80% of Indian healthcare happens out of pocket. So you put aside this, you come into spending on cancer-related healthcare when there is a diagnosis. But for prevention, there's not enough awareness. There's not enough resource allocation from the families.
Yes.
And just limitation to resources when we talk about government funding. And there's no concept of visit with your doctor.
Well said.
You're just going to get checked out, even if you're not feeling.
Yearly checkup is a norm in the Western cultures, right?
Because the insurance actually pays for it. That's why people can do those tests. Yeah, it would be good if our governments could introduce a policy like that. But given the circumstances, I mean, we have to operate in our own culture, in our own society, and we have got our own norms, we have got our own limitations. So given that, screening is not really a viable option. All these screening processes, these are not very cheap either. They cost quite a lot of money. So for someone just to go and do the screening, and once they get the report and sees that they haven't got anything, it feels like I have just wasted my money, isn't it? So that's why people don't want to do it. And the other thing I would say is, why worry about screening when there is no sign or symptom at all? If I'm feeling energetic, healthy, I don't have any problem, why would I worry about going for screening? I mean, yeah, if I have got tons of money, then probably I can do it, just to make sure. But that's one of our limitations. We don't have a ton of money, and so it becomes tricky. The other thing I would say is, in terms of this screening thing, first, it's expensive, and the other thing is, every time you go for screening, you actually go through a stressful situation, because every time we go for the screening, we hope that nothing suspicious will come out, but until we get the result, we do worry. So this actually raises our um, stress level, which can lead to higher inflammation, which can lead to development of cancer. So um, I would rather focus on how I feel. Probably it's a good idea to educate people about the signs and symptoms of cancer. So if people know that if I feel in this way, or if I have this particular sign, then probably I should quickly go and get some screening test done. That will probably be a better approach, because that way, when I feel that I need to, because there is something wrong inside the body, that's when I go and get it checked. And I can justify to myself that because I felt this way, it was a good idea to make sure that I haven't got this or that. But when I'm healthy, I'm feeling well, I've got no signs and symptoms, no issues at all, and you want me to go for screening, spending money from my pocket when I haven't got a ton of money in my pocket, people are not going to do that, right?
Starting the age of 40, your insurance will start sending you reminders. You've got to go and get checked up with your primary care physician, PCP. That's what was called in New York. So you need to go and get checked up with your PCP, and you need to be in that. You need to have your flu vaccine. You need to have your, correct cancer screenings done. And these are things that the reminders will come through the insurance, through your primary care provider. That culture is yet to be established in India, I feel.
Yeah.
You said this really amazing thing. You said prevention, right? Now, I find it interesting in India, where constantly prevention is you eat these superfood foods, haldi le lo, or you go for your walks, you meditate, you exercise, you eat well, you bring down the amount of alcohol you're consuming, whatever that may be. You live a generally healthy life.
Healthy life, yes.
Is that adequate prevention? How can I prevent cancer?
That's a very good question. Now the
If you
advertisement
look
is here.
younger
Let
than your
me
age,
play the advertisement.
you
Go
might be
through
one of
it.
us.
Be
The 12
tortured
types
by this advertisement.
Questions are
Okay, so basically what Faye is asking here is, how can we prevent cancer? Now, we will listen to the answer, but I mean, because I've watched this video before, the answer is really disappointing, because, see, Dr. Sewanti, she basically keeps on saying that if you do this screening, that is like prevention. And this concept doesn't make sense to me, because, you see, once you go for the screening and realize that you have got cancer, uh, you didn't prevent anything. And if you go and got the screening done and the report says you don't have cancer, you haven't prevented cancer in any way. Rather, what Fai said is actually quite interesting, quite important. Based on the explanation that I gave you guys about cancer, healthy lifestyle is the most important tool that you can use to prevent cancer. What sort of healthy lifestyle? Exercise, really good. But the first thing I should really say before talking about exercise, it's food. Our diet makes a huge difference. And in India, in other parts of the world as well, we are carbaholics. We consume carbohydrates like there is no tomorrow. So carbohydrates, when we consume too much carbohydrates, they can raise the inflammation level in our body, and they can cause mitochondrial damage, and that can later cause cancer. To say this in another way, if we get rid of carbohydrate from our diet, experiments showed that the body starts performing better. The mitochondria actually becomes healthier. So whatever you can do to make your mitochondria healthy and strengthen your mitochondria, that will prevent cancer. So diet is the first thing, and it has to be a low carb diet, because low carb diet basically makes sure that your mitochondria becomes stronger. Then the next thing you need to do is, obviously, you need to avoid the carcinogenic, the environment that can cause cancer. If you live in a area where the radiation is too high, you should move out somewhere. If you live in a near, say, an airport, then you can get toxic burnt toxic gases from the airplanes, and that can cause cancer further down the line. So these things you need to be cautious about. So these are things you can do to prevent cancer. Um, Eating turmeric, that doesn't really do much, but some people believe that it helps. They can do that. They can consume turmeric as well. Um, uh, Not, I mean, it doesn't really cause a lot of damage either, so might as well have it. Exercise really helps. Yoga can deal with your stress, and that can be really beneficial to prevent cancer, to protect yourself from cancer. And uh, yeah, environmental things, and try to take vaccines for like HPV virus, human papilloma virus, or hepatitis B. Should be vaccinated against that so that you don't get that terrible virus. You should make sure that you don't have Helicobacter pylori in your gut, causing gastritis, which can lead to cancer later. So if you modify your lifestyle, you can actually prevent cancer with this modified lifestyle. But screening, oncologists, they keep on saying the same thing. You do the screening done, and that is like you are preventing cancer. It just doesn't make sense to me, because that's not what screening is. Sorry, that's not what prevention is. But they keep on saying the same thing. It's kind of like they are trained in this particular way, and they're kind of like they just memorize these words, and every single oncologist, wherever you go, will say the same thing: get the screening done, get the screening done. And that's how you prevent cancer. How?
Are amazing. And yes, healthy life is the most basic prerequisite. So healthy life, healthy diet, whatever it is, there are lots of discussions around it, and there always will be, because it's not just cancer we are battling. We are human beings. We are battling many, many health ailments. So all of that done, and still we don't know that there may be a trigger for me, right? My body may be oriented differently. A trigger for me may be very different from a trigger for you. There are people who are chimney smokers all their lives, and they will not get lung cancer.
Yes.
And then there is this meeting that I was in where someone got up and said, my mom got lung cancer, advanced, that went to the brain, but she was in a village. She had never smoked. She lived a life where there was no pollution. What may have been her trigger?
Well, in the village, nowadays, it's not really a pollution-free environment anymore, because in the village, people produce vegetables and this and that, and they use pesticide, and a lot of it, to make sure that the bugs don't eat up the produce. So you get problems from that. In the village, there are fields, even though you don't produce anything yourself, but others are producing things, and they're using pesticide and herbicide and things like those, and those things are getting washed during the rain, and these all these things are coming and getting mixed with your water supply, and you get problems. So it's sometimes quite tricky to actually pinpoint exactly what caused the problem. And once you get cancer, it's pointless to worry about that. It's good if you can identify the source, then you can probably do something to stop that from happening. But once you have the cancer, the better idea is to focus on how we can stop it. So Yeah, if something is obvious, if you are a smoker, then yeah, stop smoking. Makes sense. If you lived in a environment in a neighborhood where the environment is really polluted, move away from there, move out, go to a different place. Obviously, you should do that. But if in case of a scenario like this where we don't know exactly what caused the cancer, don't worry about it. Let's focus on how we can um, control the cancer cells and basically take away the power from them so that they cannot grow anymore, so that they become weak. And sometimes we can use strategies to basically shrink the tumor, make them smaller, and gradually kill them, and then stick to that lifestyle so that they cannot come back.
So cancer and trigger, not entirely understood. So the triggers that we understand are best avoided, but the triggers that we don't understand need to be watched out for.
When we diagnose early,
If we don't understand the triggers, how can you watch out for that trigger? That's another complicated question, isn't it?
and everyone knows that cancer, for those of you who don't know, there's stage 1, stage 2, stage 3, stage 4.
Yes.
When we diagnose early, what difference does that make to you in your job? If someone comes to you at stage 1 or stage 2?
So huge differences. When someone comes with advanced cancer, mostly when we say advanced cancer, it means stage 4. But it could also be stage 3 and it's locally advanced when it may not be able to be cut out. So most solid organ cancers, which just means not blood cancer, but everything else. Most solid organ cancers either are cut out or burnt with the radiation.
Okay.
Right? So if someone has cancer of the oral cavity or mouth, it's supposed to be cut out. Surgery done, tongue cancer surgery done, buccal cavity cancer surgery done. Someone has breast cancer surgery done. When the person presents with a smaller cancer, the surgery is less.
I have a problem. I can
Another
read in
advertisement.
English,
Go
when
away! I
people
hate
speak,
you. I can
I
speak
don't
English as well to some
The
extent.
surgery is simpler. The surgery does not involve a whole lot of reconstruction, and aesthetics can be preserved. Morbidity that comes out of it. Someone has a locally advanced lung cancer. They will undergo a very mutilating surgery. Even after the reconstruction, their swallowing will be affected, their speech will be affected, and aesthetics will be affected.
Yes.
Their daily quality of life will get affected. But if someone has a very small, tiny nodule in the breast, it can be taken out with an organ sparing approach. So that person will just need lumpectomy, not an entire mastectomy. Mastectomy is where the whole breast is removed, and lumpectomy is when you do just wide local excision and you take the lump out, you leave good clean margins. You still need to do radiation, but the organ is preserved. So I think it's all aesthetic and less morbidity, less time to recovery. But what is one of the toughest parts of oncology is the endpoint is very harsh. In oncology is one subject we always talk about overall survival. Because cancer and death are words that are not synonymous but have become synonymous. And so anyone who is diagnosed with cancer always thinks about how long am I going to live? So if that is the question that we have in our mind, then early stage makes you live longer.
So that is actually why cancer is such a deadly disease, because the end result is a very quick death, very rapid death. So um, even though the information that she shared right now talked about surgeries, these are really good strategies basically to deal with cancer. And so if you detect the cancer early, you will be able to get it out quickly, and that will give you some probably benefit, some leverage so that you can survive longer. The problem is usually oncologists don't tell you to change your eating habit after you get diagnosed with cancer. So they need to tell you to get rid of the carbs, but they don't. So, and interestingly, in some cases, the oncologists actually encourage you to eat more carbs so that you don't lose weight. And that is the worst advice you can give to a cancer patient. Oncologists, they believe in the DNA thing. They don't believe in the mitochondria's damage. They don't believe in the idea that cancer cells live on primarily on sugar. So they just tell you to eat whatever you want to eat. And so what happens is, even though you're diagnosed early and they do a little lumpectomy or a little surgery somewhere to get rid of the little tumor that was trying to develop, you are still in risk because you haven't changed your lifestyle, because you haven't changed your eating habit. Your body is actually going through the same pressure that it was going through before. So the first tumor that or the first tumor developed in your body because of your lifestyle, and unless you make change to that lifestyle to one where the body becomes a difficult place for a cancer cell to get hold of, you are again going to get another tumor somewhere else, and then you will die. The other terrible thing that happens is once you are diagnosed, oncologists, they take out the tumor, and then they give you radiation and chemotherapy. They say, we are giving it just to make sure, because we don't know if there is another one anywhere in the body, so just to make sure. Sadly, chemotherapy is a poison, and all the chemotherapies that we have, they are actually poison that are administered into our body to a certain amount just to make sure that we don't die. It's poison, but they will give it in our body in such a way that we don't really die. But it is poison. So the body will get damaged in multiple ways. Your brain will get damaged. Your digestive system will get damaged. Your hair, your skin, everything will get damaged because it's poison. So that makes things actually worse sometimes. As a person who got diagnosed early and the surgery was done successfully, and then there was no other cancer in the body based on the scan, but then they still gave the person chemotherapy, and now because of the toxicity of the chemotherapy, you can have cancer later. So this is like it goes both ways. It can save your life if if the detection is happened early. It can save your life, provided that you make some changes in your life to make it difficult for cancer cells to grow in your body anymore. But if you don't do that, then it can actually backfire and cause more harm.
Someone gets diagnosed in early stage, they are living longer than advanced stage where life is curtailed, where there's a limitation to how long you can live because cancer is in different shape and form, and the face of cancer in advanced stage is different.
So if you are diagnosed early, obviously you get a bit longer. Now, sometimes it's because the treatment was successful and then you get a long life. But in other cases, even though the treatment actually didn't do anything, still you can claim that, okay, you still lived a bit longer, because if the diagnosis happened 6 months later, then you had only 3 months. But now we got the diagnosis done today, now you've got 9 months, which technically, hope you can understand that it's basically the same. So the drugs, the treatment, if it doesn't do anything, then if you are diagnosed early, we can claim that you lived longer because the time from diagnosis to your death is a little bit longer. But actually, it is not longer because actually the treatment didn't work.
What are the most common cancers in India that we come across? And I know that you're looking at these numbers right now.
Yes. So oral cavity is one of the highest grossing numbers in India.
Is that because of chewing tobacco alone, or is it because dentistry is not as popular in India either?
So both. I would say chewing tobacco has a huge impact. Smoking has a huge impact. Then there is this group of people in India where you will not see chewing tobacco, you will not see smoking, but they'll still have tongue cancer or buccal cavity cancer, and that there is a genetic predilection in families that could predispose someone.
There is a fear of chemotherapy. A lot of families feel like, and a lot of patients will also say, I don't want to do it. It seems too hard, too painful. Can you explain to us what happens in chemotherapy?
Let's be real. Most people
Not
over 40
again.
use ChatGPT like it's Google. Copy,
Oh,
paste, ask a basic
I'm
question.
so angry.
So chemotherapy is something that is given intravenous or through a delivery system, which is like a chemo port or a PICC line. The problem with chemotherapy is that it kills the cancer cells, but it also kills rapidly dividing normal cells.
The first thing we should say about chemotherapy is poison that is administered, hoping that the poison in the right kind of dose will kill the cancer cells and not kill the host, not kill the person. That's the kind of like dosing they will ensure. But it is poison. That's the first thing you need to remember. And that's why people don't like it. Because if you take poison, even if it doesn't kill you, you feel like, I shouldn't say those words, right? You feel like crap. Yeah, I can say that probably. So that's why people don't like chemotherapy. And as I explained, chemotherapy can cause a lot of trouble. Chemotherapy can damage your organs. Chemotherapy can damage your brain. And then you survived your cancer, but now you lost your ability to think properly. Your personality is changed because of the chemotherapy, chemo agent. That's terrible, isn't it?
So the mucosa, the inner lining of our mouth, is rapidly dividing.
Yeah.
So someone has good doses of chemotherapy may actually have ulcers in their mouth. Hair follicles are rapidly dividing. So hair loss is a commonly dreaded complication or dreaded side effect of chemotherapy, different kinds of chemotherapies. And we have this scalp cooling system to prevent major hair loss. And a lot of the brunt of chemotherapy happens on normal cells, your skin, your mucosa inside, hair, and blood counts from your bone marrow. So people over the last several decades and families after families, generations after generations, have these memories where folks who were undergoing chemotherapy had to undergo so many side effects, live through so many side effects. Even though the side effects are much better managed in the current times, each family will come with a memory of the past and having a loved one go through a very difficult journey. And that's what makes chemotherapy so dreaded and difficult.
Now, let me quickly give you this information. Professor Walter Longo, he conducted some studies, experiments, and what he found is if you are fasting while taking the chemotherapy drug, chemotherapy treatment or chemotherapy, you have a far better chance of actually getting a good response to the drug, and at the same time, you will have a lot less side effects. Why is that? So Professor Longo, he recommends that you go for a 3-day fast. So for 3 days, you don't eat anything. So the day before your chemotherapy, you should stop eating on that day. You can drink water, you can drink black tea or black coffee, but that's about it. You can take a little bit of salt in your drinks as well, but no other food. So that'll be the first day, first 24 hours before the chemotherapy, you should fast. And on the second day, you should continue fasting. And that's when the chemo should be administered. And then you should continue fasting for another day. What happens is when we fast, our healthy cells, they go through this a special process where they basically try to protect themselves in this harsh environment when there is no food supply. And so they don't take anything from the blood, and they stop growing. They stop any kind of growth related activities. They just stop. The cancer cells cannot do that. Cancer cells don't have that ability. So in this changed, harsh environment, the cancer cell keeps on growing, and growing means it needs more and more nutrition from the blood. And because all the other cells, the healthy cells, are not taking any nutrition from the blood, nutrition in this particular case is chemo drug, basically. So because the healthy cells are not taking the poison in, the concentration of poison in the blood remains high. So the cancer cells, they keep on chugging these nutrients from the blood, and in the process, they also take the poison. So they die more. And because the healthy cells, they were not taking the chemo, they don't get affected as much. And because you keep on drinking water and you fast for the next day as well, so 72 hours first altogether, what happens is by then the chemotherapy drug gets out of your system, and your body is back to kind of in a better, healthy, more friendly state. And that's when you start eating healthy food again. So if you eat nutritious food like meat, red meat, um, um, fat like ghee, butter, if you start eating those, your body gets the nutrition because the healthy cells were not affected by the poison as much. You feel much better. So if you have to take chemotherapy, this is a trick you can use to save yourself from the extreme side effects of chemotherapy. And at the same time, this therapy will probably work better. The best idea is to stay on a ketogenic diet because the ketogenic, when your body is in the ketogenic ketotic state, producing ketones, it doesn't have extra sugar, so the cancer cells are not getting a lot of food. They become weak, and if you then start fasting and get the chemo drug, they just gets destroyed like there is no tomorrow. Okay, so that becomes very effective. Um, the chemo, when you are in that state of ketotic state, your body basically runs on fat and ketones. And the healthy cells, because they can use ketones and fat, they stay very healthy and they actually become healthier. So that's a trick every cancer patient should remember. Always on ketogenic diet, stay in ketosis. Then if it's time for you to take chemotherapy drug, 3 days fast. The chemotherapy should be on the middle, on the second day. And then once you start eating again you should follow the ketogenic diet, basically.
I'm going to come back to our screening question. So if I want to prevent cancer, obviously live a healthy life, but what should I screen? How often should I screen? Who do I go to get screened?
That's a not very wise question. I wanted to actually say a stupid question, but that will be rude, and that's why I'm not saying that. I'm saying it's not a very wise question. Why? Because screening is not prevention. Screening doesn't do prevention. Screening detects your disease if it is already there. If it is already there, you haven't prevented anything. If it is not there, you haven't prevented anything. So screening and prevention, no, it doesn't work.
In terms of prevention, I'll say two things and then I'll come to screening. Prevention, one, we talked about the eating right and avoiding carcinogens, the known carcinogens as per American Cancer Society, which has been a leading organization to propel cancer awareness.
And this, because of this American Cancer Society, they are actually spreading a ton of misinformation, and that is not helping anybody, especially the cancer patients, because they. Let's listen to the answer. You will understand why.
Three things: large, alcohol, tobacco, and red meat.
Red meat. The whole human civilization basically survived on red meat for the longest period of time. So human civilization, as human beings, we learned agriculture like about 12,000 years, some scientists say. So before these 12,000 years, so if we go back like 20,000 years, then nobody was doing agriculture and people were living on hunting. Human beings were actually living on hunting. That means they were killing animals and eating them. And what sort of animals were they eating? They were killing and eating the biggest. The bigger the animal, the people were actually trying to kill that more compared to the little ones. I mean, if there was a little rabbit, they would just let it go. They won't bother chasing a rabbit to kill it. But if they got a megafauna or an elephant, they will team up and they will attack the. We actually got rid of all the megafaunas from the world because we ate them all. That's what human beings did. So red meat causes cancer is such a ridiculous idea. Well, I mean, it's not really their fault that they say this. There was this, back in 2015, there was this report from WHO who claimed that we have looked into the literature and we have come to this conclusion that red meat is carcinogenic. So they came up with that report, and later on, scientists asked for their detailed report of exactly how they came to that conclusion. And looking at the conclusion, looking at how they picked up the studies to include in their decision-making process, people were like, what the, yeah, I don't want to say the last word, but that's how the expert actually reacted. Because one reason probably was because almost half, or probably a little bit more than half of the people in that committee who came up with this conclusion were vegetarians, vegans. They don't like eating meat. So they came up with, they picked up or they selected all these studies that said slightly negative things about meat. Some of these studies were conducted by vegetarians. So there is this obvious bias there. And recently, so now it's 2025, recently there was a meta-analysis on the natural red meat only. Natural, I mean not processed. So unprocessed red meat consumption, there was this meta-analysis done, and this basically showed it doesn't raise your cancer risk any way, shape, or form at all. For processed red meat, yeah, there was a association between cancer and processed red meat. But then if you ask, what is a processed red meat? A pizza is a processed red meat. Obviously, that's just dumb, isn't it? The pizza has got a ton of carbohydrate, the flour, and then it has got a ton of cheese, fat, and then it has got a few slices of processed meat, and then you label the whole thing as you are eating processed meat. So if you do your studies in such ridiculous ways, obviously the result is going to be ridiculous, and some other expert is going to rely on this result to come up with some conclusion which doesn't make sense at all. So that's what I have to say about this.
These three things have been cited as carcinogenic at any level.
Yeah, no, it's crazy. Another advert. Probably it's a good idea to watch the advert because she's just saying weird things.
Okay. So we at least be aware of that and put that in one bracket. And then we move on to what else do we know? So sugar and cancer, that relationship is not well understood.
This is just crazy. I mean, I find it really difficult to digest such kind of a statement because the way we detect cancer, the test is called PET scan, positron emission tomography scan. And the principle that this scan uses is they inject FDG, fluorodeoxyglucose. So this is a special kind of radioactive glucose that they basically push into your blood, and this glucose gets basically spread out throughout the body. Cancer cells, because they take about 200 times more glucose than normal cells, they actually take this FDG glucose a lot more compared to the neighboring healthy cell. So there is a uneven kind of concentration. In the normal cells, there is a level of consumption of this FDG glucose, but the cancer tumor consumes a lot more. So then the CT scanner can detect where these concentrations are. And that's how we detect cancer. So the relationship between cancer and sugar is very clear. It's crystal clear. That thing, this principle that the cancer tumor actually consumes a lot more sugar than healthy cells is called Warburg effect, based on Dr. Warburg's name. So Warburg effect, and if you understand what Warburg effect is, then you know there is a clear relationship between sugar and cancer. But oncologists like her just say there is no relationship between sugar and cancer. Ridiculous, absolutely ridiculous. I mean, they just memorize things. They just don't think. They don't use their brain to actually think, to challenge the concept. They don't look at the evidences around them that contradicts the information that is presented in front of them, which is sad, really sad.
So what do I tell patients? I say take Mediterranean diet. So Google Mediterranean diet, read up. It involves eating less processed food and eating more natural stuff, fruits, vegetables, which a lot of India already practices. And in terms of meat, it's mainly poultry. So egg, fish, chicken, white meat is allowed. Dairy is okay. Main thing about diet that I want to leave here for whoever's watching is processed food is what we all should cut back on. It's not just cancer, it's all kinds of health ailments, because a lot of this is related to the sugar surge that happens and fat that we expose our body to, and colorectal cancer specifically, or prostate cancer, all of that, and linked to some kinds of diet. So we shun that. But a lot of diet at large is not very well understood in terms of carcinogenic diet, and people who sell fear and sell these kinds of concepts, I completely shun that behavior.
Well, she doesn't understand nutrition very well, isn't it? She's a oncologist. She was trained to um, basically memorize under what circumstances, what sort of drugs she should use. So obviously, she doesn't understand the implication of diet on a cancer patient's body. And that's why she says things like sugar doesn't make a difference. In terms of consuming vegetables, recently, there are some new ideas where vegetables are not very innocent, Vegetables don't have a lot of nutrition in them. We cannot digest vegetable and we cannot extract those nutrients very well in our gut. The nutrients that we manage to absorb and get into our blood, sometimes our body, our cells cannot really use them efficiently. Some of these nutrients come with some toxins. The vegetables that we always say that they're so good, but they sometimes come with toxins. And when you have cancer, your body is already weak. And in such a body, you don't want any toxins. So the idea of actually having a ton of vegetable at this point is not a good idea. Rather, having red meat is actually the better idea, because red meat is nutrient dense. It doesn't have all these extra, what do you call, toxic elements to them. And that's what you need. You need the healthy fat, animal fat and ghee and butter to actually help your body become stronger so that you can fight the cancer and all the consequence of the treatment. But they will tell you to go for a vegetarian or a Mediterranean diet, and then you'll suffer, and you will not know why this is happening. Sometimes you will blame the chemotherapy, sometimes you will blame some other things, sometimes you'll blame that, okay, it's probably my luck, I'm not following things correctly probably. But if you forget about the vegetarian or the Mediterranean or any diet that contains plants, if you just live on red meat carnivore diet, that should give you the best result given the circumstances.
So I've actually done a conversation with Dr. Lamaye, who's a colleague of yours, yes, and it was very interesting. There was a portion of that conversation that went up on Instagram where we were talking about alcohol and this idea that a glass of red wine or an occasional glass of alcohol is okay, and he said no alcohol is okay. Right. So that was that was the cardiologist, but as an oncologist, what is your stand on alcohol?
No alcohol is okay.
No alcohol is okay.
Alcohol is okay.
That's the interesting thing. No alcohol is okay. That's I agree with that statement. But then they say consuming fruit is okay. You see, when you consume fruits, the fruits are full of fructose. And in the alcohol, what happens is the fructose gets broken down by bacteria outside your body, and then it gets fermented, and then you consume the end product. Okay, that goes into your liver and cause the same damage that you get from consuming fructose that comes from the fruits. So when you eat fructose, your body basically does one extra step, the first step, to digest the fructose, take it in, and then it affects your liver exactly the same way it does, exactly the same way as alcohol affects your liver. So consuming a lot of fruits is a terrible idea.
Earlier, we had American Cancer Society telling us above 4 drinks a week was directly impacting on cancer causation, especially women's cancers. But the revised data 10 years later and more recently tells us no alcohol is okay, because alcohol directly adds to field cancerization. So wherever you
We get it.
Not
You don't
another
really want your
advert.
kids watching videos, but it can have certain
drink and whatever area gets exposed to alcohol, there is a transformation that can happen
What
over a
time
period of
is
time
it?
that is called field cancerization. And then, of course, once the alcohol gets absorbed, it has so many different levels of carcinogenic impact that no amount of alcohol is considered okay from an oncologist's perspective also. So you have a two-fold.
I have a two-fold now. But you also said red meat. Again, no amount of red meat at all?
So no amount of red meat at all. Now, when
Crazy. Absolutely crazy. There is, I mean, let's not talk about it. I mean, if you can go and do your own research, you should go to Dr. Georgia Eade's website. It's called Diagnosis Diet by Dr. Georgia Eade, EDE. And she actually explained this whole thing about red meat causing cancer, which is rubbish, plain and simple rubbish. Okay, the oncologists were trained to say that, but in reality, this is just pure and simple rubbish. So do your own research. But if you are a cancer patient, probably sticking to a carnivore diet where you eat red meat, fat, salt, and water, that will probably give you the best chance of surviving.
we talk about our friends and family and the cancer community at large, people ask me, can I not drink one time? And can I not have red meat one time? And it's not cyanide. These are not cause and effect immediately that someone, if they took, and those who have taken, notice. But it's not something that can be propagated from guideline perspective. We know that these are directly carcinogens, and we have to minimize the intake to every extent possible. It's not something that I will cut out completely and say not even a swig of red wine is barred. That's not true. But In terms of quantity, we know that a build-up happens, a cumulative impact happens, and over a period of time, even with the least alcohol intake, it can add an carcinogenic impact, and similarly to red meat, and similarly to smoking.
In India, we have a very specific
No,
diet.
not
We
with
eat a lot
red
of carbs.
meat.
We eat a lot of dals.
I mean, you can watch Professor Thomas Seyfried's lectures on YouTube. There are quite a few. And then there are quite a few carnivore people who had cancer and they were trying to do lots of different things with their diet. And finally, when they started using the carnivore diet, they realized that gave them the best result. And that's why some of them, some people were basically given death sentence by their oncologists. The oncologists clearly said that maximum a year, maximum 3 weeks, maximum 6 months. And these guys are still alive, well, and healthy. They're healthy because they believe that their food habit, just this carnivore diet, has made a tremendous difference. And it makes sense because red meat is full of nutrition. I mean, it's really full of nutrition for human body. Once you get the nutrition, once you get the healthy fats, your body has all the supplies that the body needs to become strong and fight cancer or any disease for that matter. So it's just ridiculous to say that red meat is going to cause problems. There are studies, these studies, they show results in both ways. There are studies that shows that if you consume vegetable lot, like fibrous vegetables a lot, you can get cancer. You can get colon cancer from that. So, yeah, I mean, if you have cancer, it's your life. And so you should do the research and then you should take the decision accordingly. Don't just listen to your oncologist. Your oncologist is not not a nutritionist,
don't eat as much protein as the rest of the world. We tend to now use a lot of refined oils in our households. Is there something in our diet that makes us particularly vulnerable to cancer?
So some of the diet practices, like smoked food, like pickled food, so if you read cancer and diet literature, what's really becoming clearer and clearer, quantities of sugar and salt, everything in moderation. So if you think about pickle, it's all salt and sour. So cutting back on that and using it once in a while, I would say. Then
No, she's missing the mark on salt as well. You see, the thing about salt is you can actually consume too much. It's not the same as sugar. Sugar is sweet, tasty, and most people like the taste of sugar. So they can consume a ton of sugar in one sitting. Whereas in terms of salt, yeah, we like salt to a certain extent to mark. But then if it is more salty, then we don't like it. So pickle, you can take a pickle. If it is too salty, you will not be able to really enjoy it for long. So salt is not salt cannot be really blamed exactly the same way as sugar is blamed. And sugar, in case of cancer, sugar basically is the direct food of cancer. So it's a good idea not to have sugar at all. But in case of salt, salt is not feeding the cancer cells. So we should be more liberal in terms of consuming salt. The other thing I would say is if you follow the information that or the strategy that I'm talking about so far, like a ketogenic diet or a carnivore diet, your insulin level will go down, and insulin is the hormone that causes salt retention in your body because it stops the kidneys excreting salt from your body. So when you are in a ketogenic diet or in a carnivore diet, the insulin level goes down in your body. So the kidney becomes an open gate for sodium to be excreted. So then you actually need to consume more salt. Otherwise, your body will actually lose too much salt and you will become you'll have headaches or you will become, um, you'll have brain fog, you will feel weak, and all these side effects. Some people call it keto flu, but you only get keto flu if you restrict your salt consumption drastically. So for cancer patients, if you are trying, if you uh, follow a ketogenic diet or carnivore diet, you should increase your salt intake. So 2 to 3 teaspoons of salt should be consumed every day, according to the information published in a 2018 paper called a Pure Study, Professor Andrew Mente was one of the authors there. So if you search the name Pure Study Andrew Mente Salt, you should find this finding, where they found the healthiest, longest living people in the world, they consumed like 2 to 3 teaspoons of salt every day. So that's what I would say about salt.
Of course, we are carb loaded. I joke around this all the time that when I was growing up at my home, we would have the basmati rice and the parboiled rice. And India being India, the staff would end up eating the parboiled rice and the basmati rice and whatever.
And so the head of the household.
The head of the household would be eating the basmati rice. But what do I eat today?
Parboiled rice.
I eat parboiled rice. So that's how we have to change with the diet. We really need to be aware, and you have to eat whatever everybody is eating, and that's what everyone should eat. You know, fruits, vegetables, less processed food, as much as you can. Bring in uncooked food to the table.
No, if these uncooked foods, they have carbohydrates, you should stay away from them as well. The rice, the breads, just don't go near them. Okay, get rid of them from your life forever. Okay, if you want to survive, because you may say, I like the taste. Okay, you like the taste, and if you want to die, then go for it. But if you don't like the idea of dying early, probably that taste, you cannot enjoy that anymore. You have already enjoyed enough, and your body says, no more thanks. So you need to stick to that.
Is it helpful to buy organic food? Or is it just a trend at this point?
So I think, when we say organic food, at least you're attempting to make less, indulge less in preservatives. You're indulging less in processed food.
Yeah.
So not all organic is unprocessed. We have to be really careful about interchanging organic with processed and non-processed. But at least you're paying attention to how the food is being grown. So whether or not that is the magic bullet, we don't know. But that should be the way of living. That should be the way of farming. And that's why organic is to keep, for sure. But whether that is the answer to everything, and especially to cancer, we just don't know that.
Yeah. Next advertisement. When is it due?
So we stick around with this kind of diet, then we talk about what else, and that's exercise. And now we have more data with exercise than we have with diet. So 3 to 5 times of mild to moderate intensity exercise in a week has been shown to severely reduce progression if someone has cancer, and recurrence if someone has had cancer in the past, and also in cancer prevention. So that these two things, diet and exercise, if it can lead to 10% weight loss, it's even more beneficial. And this data comes out of the Women's Health Initiative study that was done in 20,000 women who had cancer and were followed for 20 years. And it was shown that if they had 10% or more weight loss with diet and exercise, that their second chance of having malignancy severely reduced. So I think
that's very important. And using a ketogenic diet, you can actually get rid of your extra weight without any effort. But that doesn't mean you shouldn't do exercise. You should do exercise because exercise actually helps in multiple ways. For a cancer patient, exercise is very important. It's better if you can do some weight lifting exercise, if you can do exercise with weights. But if you cannot, because of the health situation, you should still at least go for a walk. If you cannot walk, if you can just sit on a chair, just keep on moving your hand and legs and keep your muscles working. Because cancer, one of the deadliest things cancer does is basically dissolves your muscles and use the muscle components to make energy. So you should make sure that cancer doesn't get that chance. If the muscles are in use, they don't get affected by cancer. So you need to do that. The other thing I'd at this point mention is fasting. Fasting benefits a ton for a cancer patient. So a cancer patient should fast daily 18 hours. So finish your dinner by 8 o'clock in the afternoon, in the evening. And then you should have the next meal at 2 o'clock the next day. In the meantime, you can have water, you can have salt water, you can have black tea, black coffee, but no other things. If you feel really hungry and feel weak, you can have like a bite of butter or a spoon of ghee or a spoon of or 2 spoons of no, in case of coconut oil should stick to 1, because if you consume 2 spoons, that will give you upset stomach. So you can go for those things, but that's about it. You shouldn't do anything more than that. Sorry, my wife just called me. My daughter, she soiled her nappy, so I had to go and help her to clean her up. And at the same time, I'm actually getting bored to continue recording this video now because obviously some of the things that Dr. Sewanti is telling us is not really the scientific facts anymore, because you see the whole concept that Dr. Sewanti or any oncologist basically relies on, or the theory that that basically is the foundation of modern day oncology, is the somatic mutation theory, where the concept is because of the mutation in the gene you get cancer. And I've told you towards the beginning that that's not the case. Genetic mutation is actually the result of cancer developing inside a cell. So all the theories, the explanations, the tools, the drugs that were developed based on the somatic mutation theory, they don't really work all the time, because that's not really the cause. So let me give you some information about that. So recently, in a few studies, they found that there are healthy cells which have got cancer driver gene in them active, but they are not cancerous cells. So these were samples basically collected from, people go for cosmetic surgery. So the surgeons, they get rid of some part of their skin tissue. And this discarded skin tissue was basically preserved for research purpose. And after looking into this skin tissue, about 25% of them have got cancer driver gene active in them, but they are not cancerous. So how can you have a healthy cell when the gene has got a cancer driver gene? That doesn't make sense. The other thing is, about 37%, as far as I remember, I have to check on that, but yeah, quite a big number of cancer cells actually don't have any gene mutation at all. How can you have cancer if you don't have any gene mutation? If gene mutation is the cause of cancer, it doesn't make sense. Then Professor Dr. Thomas Seyfried, he basically collected a lot of studies. These studies are called the nucleus transfer experiments. So in these studies, they found that, so you've got a cancer cell and a healthy cell. The healthy cell, it divides and becomes two healthy cells, and the cancer cell divides, becomes two cancer cells. Okay, the somatic mutation theory says it's because the healthy cell has got healthy DNA, and the DNA is inside the nucleus of the cell, and the cancer cell has a broken DNA. So what the scientists did is they took the healthy nucleus from a healthy cell and replaced it on the cancerous cell. So the cancer-affected nucleus was removed and the healthy nucleus was put in place of it. The result was, after division of that new cell, it was still a cancer cell. So a cancer cell which has got a healthy gene at this point, it still resulted in cancer cell. Then they did the opposite experiment. So a nucleus from a cancer cell, which has got broken DNA, was replaced inside a healthy cell. So if DNA mutation or gene mutation is the cause of cancer, then this cell should now become a cancer cell. But it didn't. It still behaved like a normal cell. So from these experiments, these observations, it is pretty clear that DNA mutation is not the cause of cancer. I mean, it can be a cause in a very small number of 3 to 5% cancer cases. It can be a gene mutation can be a driver, but for the others, 95 to 97% cases, gene mutation is not the cause. Rather, gene mutation is the result of cancer. So that's one problem. Then the Cancer Genome Atlas, there was this massive project where they took lots of samples of cancers, and they basically did the gene sequencing of all these different kind of cancers. The concept was that if we have all the different variations, gene mutations that we can have in a cancer cell, then we will be able to come up with effective treatment to deal with these DNA or the gene mutations and fix them, and that way we can deal with cancer. What they found is in a single tumor of a patient who may have few tumors in the body, in a single tumor, there may be 10,000, 20,000, 50,000 different gene mutations on different cells of one tumor. So then how do you address that? How do you fix? I mean, because fixing one gene mutation costs several $100,000. So if you have so many, thousands and thousands of gene mutations, this is not a target that you can really work with. Right. So that's the other problem. So given the other thing they found is, like, we hear about the targeted therapy where a specific gene mutation is targeted, and the assumption is this gene mutation only is present in the cancer cell. But nobody actually tests the whole body, right? We don't take samples from every single organ system and then make sure that this particular gene mutation is not present in anywhere else. And what happened is when these therapies were used, suddenly in a few cases, they found that the patient actually died quicker. So based on normal circumstances, based on their normal treatment, the patient was expected to live for 6 months. And then this targeted therapy was used, and the patient died within 15 days because the kidney suddenly stopped working. The liver got completely damaged. Why? They looked into the cells and they realized the mutation that was targeted were present in the liver or in the kidney or in some other parts of the body. So this is called hyperprogressive disease. So you see, this is not really a theory that we can rely on, and this is not a strategy that we can reliably use to actually deal with cancer. It's far easier basically to try to cut off the fuel supply for the cancer cells, and I've already told you what to do for that. First of all, get rid of the carbohydrate from your diet. That will cut off one of the fuel supply. The other fuel supply is glutamine, which is an amino acid. The problem is it's a non-essential amino acid. That means our body can actually produce this amino acid. And this amino acid is used throughout the body for various functions. So there is no way we can stop it. But, the cheap antiparasitic medications like albendazole, they have an effect where they can stop the cancer cells specifically to use the glutamine as a source of energy for them. So if somebody is in a ketogenic ketotic state, their carbohydrate supply to the cancer cell is minimum, and then you cut out with albendazole, you cut out the supply of glutamine. Now both of these fuel supply gets cut off, and the cancer starts dying. And the same thing happens if you fast for quite long. Professor Thomas Seyfried says that if somebody can fast for 15 days, 20 days, 40 days, they can get rid of their cancers. And I mean, there are quite a few people who have actually done that. Guy Tannenbaum is one of them, who had prostate cancer, which spread all throughout his body, and he went for a fast. He continued fasting for 21 days, and then he had food for another 2 days, and then fasted for another 21 days. I think that's the protocol he did, or he did complete 40 days fast in one go. And then he went for a checkup, and all the tumors were gone. Now, how does that happen? How does that happen? Professor Thomas Seyfried talks about this process called autolytic cannibalism. When we don't eat for a long time, few days, the body starts looking for anything that is not useful. Obviously, the cancer tumor is not useful for the body in any way. So what happens is, when we are in that sort of a stressful situation, not eating for a few days, what happens is the the cancer cells become very weak, even though your healthy cells are not actually getting weak, because healthy cells are living on ketones and free fatty acids that you have plenty in your body. So the healthy cells are happy, but the cancer cells don't have food. Now the healthy cells, they're happy, but then they're looking for anything that they can basically get rid of, because food supply is not coming from outside. So then they target the cancer tumor. They just eat it up. The body basically goes and eats it up. That's called autolytic cannibalism, and that's how the cancer gets dissolved. So you can get remedy from cancer in that way. The benefit of daily fasting, 18 hours every day, is that if you do that regularly, then after about 12 hours of fasting, there is a process called autophagy that takes place in our healthy cells. So the healthy cells, when they don't get food for about 12, 15 hours, what they do is they basically try to start cleaning up the inside of the cell. So cleaning up inside the cell and chewing up anything that is not useful there, make it clean so that the body becomes clean and it can perform better. So the immune system becomes stronger. So this is called autophagy. This happens inside the cell. And autolytic cannibalism happens inside the host. That means inside the body, not exactly inside the cell. So if we use fasting in that way, if we are on a ketogenic diet and consuming the albendazole twice daily, as Professor Thomas Seyfried says, that, I mean, he said if he had cancer, then he will immediately go for a 5-day fast, and then he will stick to zero carb diet. And at that point, after doing that, after making sure that his body is in ketogenic or ketotic state, then he will start consuming 400 milligrams of albendazole every day, 200 in the noon and 200 at night. That's what he will do. So we can use these techniques, strategies, and because we are just manipulating the food, there is no, we are not consuming any toxic drugs. So there is no side effect. You can say that your heart disease risk will go up. The data so far doesn't say that. There, I mean, lots of things can happen, but when people do these or use these strategies and the same thing doesn't happen, then we should say that, yeah, theoretically that's possible, but in reality we don't see that. So uh, the question of somebody dying from cancer and the question of somebody surviving cancer, and they may in the future get heart disease, which is obviously treatable by other modalities, that's obviously a far better choice, right? But the even better news is, so far the experiment shows that living a carnivore lifestyle or a ketogenic lifestyle actually doesn't increase your risk of heart disease or any other disease, really. And if there are ketones in your body, ketones actually try to fight cancer in many different ways, about 13 different pathways I saw last time. So they try to fight cancer. And at the same time, when you have ketones, your brain actually gets a very top quality fuel, and your mindset actually changes. So instead of feeling like depressed and sad and all those things, you suddenly become a warrior. And because you know that these are things that you can do, instead of relying on your doctor, you can yourself do these things. You then focus on, okay, what can I do? Can I go for a walk? Can I um, uh, so your brain functions better, you become a healthier, happier person. Some people after dealing with their cancer, they said having cancer was like a blessing for them, because before having the cancer, they were suffering from lots of different kind of ailments, problems, diseases that they were thought that it was part of their life. But then cancer happened, and they drastically changed their lifestyle, their eating habit. They are on a ketogenic diet or a carnivore diet now, and they have successfully managed to fight off cancer and all those other diseases, type 2 diabetes, hypertension, cardiovascular disease, kidney disease risk, and all sorts of other diseases, mental problems like depression, bipolar disorder, things like those, they just disappeared. So now they've got a far better life compared to what they had before, even before they had cancer. So they think cancer was a blessing for them. So if you understand the concept that I'm talking about, probably you will now see that you can actually do a lot to fight cancer yourself. And that gives you power. And that's the message I want to convey to you. Obviously, it has to be scientific. Professor Thomas Seyfried is the name. Seyfried is his last name. He has got a ton of papers published on this topic. He has got a medical textbook written on cancer. You can get that book, read that book. If you are an oncologist, read that book, understand the concepts, and then alongside your chemotherapy and radiotherapy and stuff like those, allow these people to modify their diet according to the principles of the metabolic theory of cancer. If the result is better, it's better, right? If that basically saves a person, you saved another life. So hopefully, oncologists like Dr. Sewanti will look into this concept and will look into their theory of cancer, and they will hopefully understand where the gaps are, and then they will basically apply their treatment on the patients knowledgeably, wisely. So with that, I'm going to end it here. Thank you so much for staying with me for such a long time. I'm not a native English speaker, so my pronunciations are probably all over the places, and my jokes are not probably as funny as I think they are. But there you go. Hopefully, you learn something from this video, and hopefully, some of you get benefited. I'll see you later. Take care. Bye-bye.